Assalamualaikum warahmatullahi wabarakatuh. We are from Group 1. My name is Nabila binti Abdul Razak. So the first question, we will discuss on difference between drug, poison, and poison psychotropic substances and DD. First one, drug. According to Sale of Drug Act 1952, drug includes any substance, product, or article intended to be used on humans or any animal, whether internally or externally, for a medicinal purpose. Medicinal purpose can be for alleviating, treating, curing, preventing a disease, diagnosing a disease, and others. And according to FDA, drug is a substance recognized by an official pharmacopoeia or formulary intended for use in the diagnosis, cure, mitigation, treatment, or prevention of disease. It does not necessarily a poison. It can be any product or substance. It can be a psychotropic. It can be a poison, non-poison. And as long as it is used for medicinal purposes, then we call it as a drug. And it is controlled under Sale of Drug Act 1952 and Regulation CDCR 1984, which is an act relating to the sale of drugs. Next, poison. According to Poison Act 1952, a poison is a substance or a drug that are listed under poison list in the first column of first schedule of Poison Act 1952. So this drug or substances is controlled under Poison Act 1952 and regulation. Next, let's have a look on the poison list. So they are part 1 poison and part 2 poison. Part 1 poison, which is divided into group A, B, C, or D poison, and we have exempted preparation. So if the drugs are listed in part 1 of the poison list, for example, here we have acarbose, we call it a poison. There's anything related to this drug, either its importation, possession, manufacture, compounding, storage, transport, sale, and use, must refer to Poison Act and Poison Regulation 1952. I pass to the next presenter. Thank you.
Assalamualaikum. I am Siti Aminti Rosli. So, non-poison. So, non-poison is also known as non-scheduled or over-the-counter. And it is a product that contain active ingredient which are not listed in first schedule of Poison Act 1952. It can also be known as product that exclude or do not have active ingredients that fall into category of health supplements, natural product, or cosmetics. So the medicine and also products under this category is not controlled at all under Poison Act 1952, but it still need to be registered with the Drug Control Authority, which is NPRA, regardless of their classification. Next is the psychotropic substance. So according to Poison Act 1952, psychotropic substances is any substance that is specified in third schedule of Poison Act 1952. So it is controlled under Section 30 of Poison Act and also under Poison Psychotropic Substances Regulation 1989. So this is the third schedule of Poison Act. That is all from me. Thank you.
Good day, everyone. I'm Nim Syafiqah binti Sharifuddin. Okay, so dangerous drug is any drug or substance which is for the time being specified in the first schedule of Dangerous Drug Act 1952. So this first schedule is consists of 5 parts, and in addition, DD also defined as a narcotic drug, controlled substance, or a controlled substance analog that can cause harm or being abused if not used properly. Okay, so raw substance are always categorized as DD, but finished products can be categorized as either DD or psychotropics. And the authorized possession of DD are as listed in Regulation 5, 6, 7, and 8. Okay, that's all from me. Moving on to the next question.
Greetings, everyone. I am Aisha Atira binti Zabba. We're presenting on question number 2. Next. So example of drug which are products that have medicinal purposes include a tablet yas, which is an oral contraceptive, a pentasa suppository to treat ulcerative colitis and also Crohn's diseases, diprivan injection, which is a propofol used for general anesthesia, and also Montelukast granules to treat asthma. Next. Example of poison which is in the first schedule of poison list includes acyclovir, an antiviral, ruxolitinib, an immunosuppressive and anti-inflammatory, esomeprazole for peptic ulcer, and also tacrolimus, which is an immunosuppressive. Next. Example of non-poison include vitamin B complex for metabolism, iron supplementary to treat anemia, omega-3 as a source of EPA and DHA, and also glucosamine and chondroitin as supplementary for osteoarthritis for healthy joint. So these are not in the first schedule of poison list and is an exemption in the first schedule of poison list. That's all from me. Thank you.
Okay, my name is Syafiqah Syarifah Fatimah Mazhar. We briefly explain and give example about the psychotropic substance and dangerous drug substance. So according to the third schedule Poison Act psychotropic substance number 1, clobazam and zolpidem are listed under psychotropic substance. As for fentanyl and fatidine, both of these are referred under third schedule Poison Act number 2, which are listed under any product that registered under CDCR 1984 and contain any substance listed are categorized under psychotropic substance. So both of fentanyl and fatidine are psychotropic substance because it's already in dosage form. Next slide. Okay, based on first schedule Dangerous Drug Act 1952, here are the example of listed dangerous drug substance, which is forcodine, trimethoprim, nimotazepam, and also flunitrazepam. So that's all for me. I pass to next presenter.
Okay, Assalamualaikum. My name is Mama Aswiden here. So question number 3, explain the power and functions of a government pharmacist dealing with transaction involving tablet buprenorphine for mg. Okay, next slide. Okay, so buprenorphine is a strong opioid medication mainly used to treat moderate to severe pain and also used to treat opioid dependence. So in the first schedule, buprenorphine is a group B poison in all preparations. And also buprenorphine is listed in the third schedule, so it means that it is a psychotropic drug. Okay, next. Okay, so the first power of pharmacist is the power to possess a psychotropic substance. So based on regulation 3 of poison regulation psychotropic 1989. So at the sub regulation 1, the pharmacist the person is authorized to possess a psychotropic drug, including a licensed pharmacist and also a registered MP. So it means that a pharmacist is allowed to possess a psychotropic drug. Okay, that's all for me. I pass to Husaini.
Hello, thank you. So I'm Saini. I will continue the presentation. So sale and supply of psychotropic and for medical treatment. So based on Regulation 11, Subsection 1 of Poison Regulation Psychotropic Substance 1989, no psychotropic substance shall be sold or supplied for the purposes of medical or dental treatment of particular patient or animal treatment of a particular except by a licensed pharmacist, open a prescription prescribed by a registered medical practitioner or a registered dentist division 1 or a veterinary surgeon. And for subsection E, a pharmacist who is for the time being employed in a hospital, clinic or dispensary wholly maintained by the government or in an institution approved by the Director General of Health at which human ailments are treated, open a prescription prescribed by a registered medical practitioner or a registered dentist division 1 or a veterinary surgeon. Next slide. Okay, next, based on Regulation 12, Subsection 1 of Poison Regulation Psychotropic Substance 1989, no psychotropic substance shall be sold or supplied for purposes other than medical or dental treatment of a particular patient or animal treatment of a particular animal, except by a licensed pharmacist or a pharmacist in the public service to Section A, another licensed pharmacist or pharmacist in the public. For subsection B, it will be explained detail by next presenter. It's subject to Regulation 12A, which is they can sold or supply to a registered medical practitioner, registered dentist division 1 or veterinary surgeon. So I guess that is all from me. I will pass to next presenter. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Khairul Najmi. So based on the Poison Regulation of Psychotropic Substances 1989 Regulation 12A, licensed pharmacy and also pharmacy in public service can sell and also supply the buprenorphine to the registered medical practitioner, registered dentist division 1, veterinary surgeon for the medical purposes. And if they have been issued a permit under Regulation 15, they can also sell and also supply the buprenorphine. Next slide. Dispensing of psychotropic substances. Okay, based on the Regulation 17 of Poison Regulation Psychotropic 1989, licensed pharmacies and also pharmacies in public service can dispense compound and mix any psychotropic substances. Okay, that's all from me. Thank you.
Okay, so Assalamualaikum and good morning. So my name is Shafiq Abidin and we present about question number 4. So I explain the differences between group A, B, C, D, and D. Okay, so the section 2 is the interpretation of the poisons. Next. And section 18 is the restriction on the sale or supply of part 1 poisons generally. So part 1 poison, which is poison group A, B, C, and D, should not be sold or supplied to any person except by wholesale, by retail, under supervision of registered pharmacies, as registered as dispensed medicine by professionals, to be exported to purchaser outside Malaysia, and to a person or institution for scientific education, research, and also chemical analysis. Next, move on to the next person. Thank you.
Okay, I'm Vinovini. I'll explain on Group A poison. So according to the Poison Act 1952, Section 20, Group A poison should not be sold or supplied by the wholesale or retail except by a licensed wholesaler to a licensed pharmacist or to another licensed wholesaler, or by a licensed wholesaler to be immediately exported to a purchaser outside Malaysia. Next slide. Okay, so these are the examples of Group A poisons according to the highlight one in Schedule 1. Next slide. So Group B poisons. So according to the Poison Act 1952 of Section 21, Group B poison shall not be sold or supplied by the retail or to any person except where the sale or supply of poison in Group A have to follow the Section 22 and also must be supplied by a registered medical practitioner, registered dentist Division 1, registered veterinary surgeon accordance with the Section 19, and also can be dispensed by a registered pharmacy as a dispensed medicines that must adhere to the subsection 2 and 2A. Next slide. So the Group B poisons require a written prescription or either electronic prescription. The requirement are according to the stated in the slide. And for the electronic prescription, it have to be created and dated in electronic form and have to be signed with the digital sign that have to follow the Digital Signature Act and must be sent to the registered pharmacies as an electronic message to be dispensed and must contain all the similar information according to the written prescription. And also it cannot be supplied if it doesn't follow the requirement, and also if it is written partly, it cannot be supplied, and the prescription have to be endorsed. And in urgent situation, the medicine that is required in urgent, it is lawful for the seller to make an entry in the prescription book when it is given instruction by the medical practitioner, verbally or telephone instruction, but the seller have to get the prescription within 1 day of the sale. Next slide. So the poison Group B poison have to be recorded in the prescription book as a register. So the details required are the date of medicine dispensed, the serial number of the entry, the name and quantity of the poison, and the sale. If the sale by the retailer is done, the name of the patient and the name of the recipient if it is intended for the treatment of the pet, and sale of medicine that not in a prescription need the name and address of the person who sold. And for the repeated prescription, only the date, serial number, and the name of the patient. And for the prescription given orally, as I mentioned just now, it have to be confirmed within 1 day. Next slide. So these are the examples of Group B poison. So that is all from me. Thank you.
All right, so I will continue to the next section, which is section 22 for Group C poison. So Group C poison can be supplied by retail as a dispensed medicine or as an ingredients in a dispensed medicine without any prescription, but the sale must still be recorded in the prescription book as stated by Vinotini. Next. Okay, and the next one is for Group D poison. So for Group D poison, it can only be sold or supplied by retail to any person, by a registered pharmacist, to a person known personally to the registered pharmacist, or the person introduce another person personally to the registered pharmacist. Next. Okay, the sale of poison book must be recorded. The sale of Group D poison must be recorded in the poisons book, and the entry in the poison book includes the name and address of purchaser, name and address of the person who introduced the purchaser, and also the quantity and the name of poison supplied. And the purchaser must sign affix his signature into the book or forward a written order. And in the case of emergency, the retailer can supply the poison without any signature from the purchaser, but the purchaser need to give a signed written order within 7 days of the purchase. Next. So this is the entry for the poison book that is recorded for poison D. So that is all for our presentation. Thank you.